When 72-year-old Charles collapsed on a quiet Sunday morning walk, doctors were quick to blame it on age, maybe low blood sugar, maybe stress, but it wasn't either of those things. After several tests, what shocked everyone, including Charles, was the real culprit, a prescription pill he had taken faithfully every day for years. Not a new drug, not something controversial. Just a standard blood pressure medication that had quietly slowed his heart so much he lost consciousness without warning. Charles had done everything right. He took his pills on time. He followed the rules. He never imagined that something meant to protect his heart could actually push it too far. But he's not alone. Across the country, millions of older adults are taking medications for common problems like pain, sleep, digestion, or diabetes. What most don't realize is that after age 60, your body changes, and so does the way it handles medication. Some of the most common pills can quietly weaken your heart, increase your risk of rhythm problems, or mask early signs of heart failure. These effects don't always happen overnight. Sometimes they build slowly, silently, until one day it's too late. But here's the good news. With the right awareness, the right questions, and a bit of guidance, you can take control again. In today's video, I'll walk you through 7 of the most common medications that can affect your heart as you age, what they do, why they matter, and what to ask your doctor. I'm not here to scare you. I'm here to help you stay informed, stay protected, and make smarter decisions for your future. And if that sounds like the kind of support you want more of, don't forget to subscribe to Golden Heart Advice, because these years are worth protecting. Let's begin. 1. Painkillers. Let's start with one of the most commonly used medications among older adults, over-the-counter pain relievers. If you have stiff knees, an aching back, or arthritis that flares up with the weather, chances are you've reached for ibuprofen or naproxen more than once. These medications fall into a group called NSAIDs, non-steroidal anti-inflammatory drugs. They're popular because they work. They reduce inflammation, ease pain, and help people move more comfortably. But after 60, NSAIDs come with a serious warning that many people overlook. These medications can raise your blood pressure, they can cause fluid retention, and they can quietly place extra strain on your heart, even if you feel better while taking them. Here's the science. NSAIDs reduce the production of certain enzymes that promote inflammation, but in doing so, they can also affect the kidneys and blood vessels. This leads to increased fluid in the body, which makes the heart pump harder to circulate blood. Over time, especially in seniors who already have high blood pressure or mild heart weakness, this additional workload can trigger or worsen heart failure. You may not feel the impact right away. There's no flashing warning sign, but the damage can build slowly, manifesting as shortness of breath, fatigue, swelling in the legs, or dizziness when standing. Unfortunately, many people dismiss these symptoms as just getting older, when in fact their heart is under pressure, and pain pills may be part of the cause. If you're using NSAIDs daily or several times a week, especially for chronic pain, it's time to have an honest conversation with your doctor. There may be alternatives that are gentler on your heart. You deserve pain relief, but not at the cost of your long-term heart health. 2. Diabetes drugs. Managing blood sugar becomes a priority for many adults over 60. Type 2 diabetes is common in this age group, and with it comes a range of medications designed to keep glucose levels in check. One such group is thiazolidinediones, a name that's hard to pronounce but familiar to many under the drug pioglitazone. These medications are effective at lowering blood sugar, and for a time, they were widely prescribed. But over the years, concerns have grown, particularly about their effects on the cardiovascular system in older adults. Pioglitazone and other thiazolidinediones work by helping your body use insulin more effectively. The problem is that they can also cause fluid retention, That means extra water in your tissues, swelling in your legs, and more effort required from your heart to keep everything circulating. For someone with even mild heart dysfunction, which becomes more common with age, this added volume can strain the heart muscle and accelerate heart failure. Even more concerning is that these drugs can mask early signs of heart trouble. Fatigue, shortness of breath, and mild swelling may seem like part of life with diabetes or just aging, but in reality, they may be signs that the heart is struggling. And because these effects develop slowly, they're often overlooked until more serious complications arise. The intention behind these drugs is good. Blood sugar control matters, especially for preventing complications like nerve damage, kidney disease, and vision loss. But the heart must remain part of that equation. If your doctor prescribed a medication like pioglitazone years ago and you've developed symptoms like swelling, fatigue, or breathing difficulties, it may be time to reassess. Medications that help one part of your body should never silently harm another. Your treatment plan should support the whole of you, especially your heart. 3. Sleeping pills. Sleep can be elusive after 60. Many older adults find themselves waking up in the middle of the night, struggling to fall back asleep, or tossing and turning for hours. In search of relief, some turn to sleeping pills, medications like Zolpidem, or older sedatives such as diazepam. These drugs are known as sedative hypnotics, and while they can help initiate sleep, they may carry hidden dangers for the heart. These medications work by slowing down activity in the brain and nervous system. At first glance, that sounds harmless, even beneficial. Slower heart rate, lower blood pressure, deeper rest. But in older adults, this slowing effect can backfire. Your heart is more than just a pump. It's also a sensor, constantly adjusting to oxygen levels, blood pressure changes, and stress signals, even while you sleep. When sedatives dull the nervous system, they can interfere with your heart's ability to respond to these changes. The result may be subtle at first: pauses in breathing during sleep, known as sleep apnea, or irregular heart rhythms that go unnoticed until they become dangerous. Sleep apnea in particular places enormous strain on the heart. Each time breathing stops, oxygen levels drop, and the heart must compensate. Over time, this repeated stress can lead to hypertension, arrhythmias, or even heart failure. Unfortunately, many seniors who use sleeping pills never realize they've developed sleep apnea until a serious event brings it to light. To make matters worse, sedatives often interact poorly with heart medications like beta blockers, reducing their effectiveness, and they can increase the risk of confusion, falls, and even respiratory depression in older adults, a particularly dangerous combination if someone already has heart or lung issues. Sleep is vital, but if you're relying on medication to achieve it, especially night after night, it's worth stepping back. Ask your doctor if your sleep issues might be related to another condition, and whether safer, non-drug options could work, because good sleep should heal your heart, not hurt it. 4. Old antidepressants. Depression and anxiety don't disappear with age. In fact, many seniors silently carry emotional burdens, grief, loneliness, chronic illness, that make mental health support more important than ever. For decades, doctors prescribed tricyclic antidepressants to help. Names like amitriptyline and nortriptyline may still be in your medicine cabinet if you've been managing emotional or chronic pain conditions for years. But these medications, while once standard, are now known to carry significant risks for older hearts. Tricyclic antidepressants affect the balance of neurotransmitters in the brain, helping to stabilize mood and reduce symptoms of depression. The problem is, they also interfere with the electrical signals that regulate the heartbeat. In seniors, whose cardiovascular systems are often more vulnerable, this can lead to a host of issues: irregular heart rhythms, changes in blood pressure, and even a condition called heart block, where the signals that tell your heart when to beat become delayed or misdirected. You may not feel these effects immediately. They might begin as a faint flutter in your chest, lightheadedness when standing, or unexplained fatigue. And because these symptoms overlap with many common age-related complaints, they're easy to dismiss. Even more concerning is that tricyclics are anticholinergic, meaning they interfere with signals between nerves and muscles. This property increases the risk of confusion, constipation, urinary retention, and, yes, heart rhythm abnormalities. As a result, medical organizations, including the American Geriatric Society, now recommend avoiding these drugs in older adults whenever possible. Yet many people continue to take them, simply because they were prescribed years ago and never reassessed. If you're currently taking a tricyclic antidepressant, even at a low dose, and have experienced dizziness, irregular heartbeats, or new fatigue, speak up. Safer alternatives exist today, including newer antidepressants with fewer effects on the heart and nervous system. You deserve emotional stability, but not at the cost of cardiac safety. It's never too late to 5. Decongestants. A stuffy nose might seem like a small problem, but for many seniors dealing with chronic sinus pressure, colds, or seasonal allergies, over-the-counter decongestants offer quick relief. Medications containing pseudoephedrine or phenylephrine are commonly found in cold and flu remedies. They're easy to access, don't require a prescription, and seem relatively harmless. But beneath their convenience lies a serious concern, especially for older adults with heart conditions. Decongestants work by constricting blood vessels in the nasal passages, which reduces swelling and improves airflow. However, they don't stop at the nose. These medications also constrict blood vessels throughout the body, raising blood pressure and making the heart work harder to push blood through narrower pathways. For someone with a strong, healthy heart, that might not cause an immediate problem. But for seniors, especially those with high blood pressure, heart disease, or a history of arrhythmia, the impact can be dangerous. An increase in blood pressure, even a modest one, can lead to chest tightness, palpitations, or irregular rhythms. In some cases, these symptoms may feel like anxiety or restlessness, when in fact they're early signs of cardiac stress. Another challenge is that decongestants are often taken without medical oversight. Many people assume that because they're sold freely at the pharmacy, they're safe for everyone. But aging changes how the body processes and tolerates medications. What felt fine in your 40s might now push your heart past its limit in your 60s or 70s. And if you're already on medications for blood pressure or the heart, adding a decongestant can create a dangerous mix. It can interfere with your existing prescriptions, masking warning signs or amplifying side effects. So if you're reaching for a cold remedy or allergy pill, pause and read the label. Look for ingredients like pseudoephedrine or phenylephrine, and ask your doctor whether it's safe for you. There are alternatives that relieve symptoms without stressing your cardiovascular system. Temporary nasal relief should never come at the cost of long-term heart health. 6. Acid reflux drugs. Heartburn is one of the most common complaints among adults over 60. Whether it's triggered by a heavy meal, stress, or lying down too soon after eating, the burning discomfort is all too familiar. To manage it, many turn to proton pump inhibitors, medications like omeprazole or pantoprazole, which reduce the production of stomach acid. These drugs are widely used and often perceived as completely safe, especially because they're available over the counter. But when used for months or even years, PPIs can begin to affect the body in ways most people never expect, including your heart. The stomach needs acid not just for digestion, but also for absorbing vital nutrients. One of the most important of these is magnesium. Low magnesium levels over time can disrupt your heart's rhythm, leading to palpitations, fatigue, muscle cramps, and in more severe cases, dangerous arrhythmias. Several studies have linked long-term PPI use with magnesium deficiency, which can remain undetected until symptoms become serious. Additionally, low magnesium may reduce the effectiveness of certain heart medications, such as diuretics or antiarrhythmics, increasing the risk of complications without clear warning. But magnesium isn't the only concern. Chronic use of PPIs also alters the balance of gut bacteria, weakening the body's ability to control inflammation. And as we now know, chronic inflammation is a direct contributor to heart disease, increasing the risk of plaque buildup, vessel damage, and long-term cardiovascular strain. Most concerning of all is how casually these medications are often continued. What was meant as a short-term fix, a few weeks of acid relief, turns into a daily habit that spans years. Many patients don't even remember why they were started on the drug in the first place. If you're using a PPI daily and have been for more than 4 weeks, it's time to reevaluate. Ask your doctor whether it's still necessary or whether lifestyle changes, alternative medications, or a gradual taper might make more sense. Stomach comfort is important, but it should never come at the expense of your heart's long-term stability. You deserve a plan that addresses both. 7. The number one pill that needs supervision. Let's return to Charles, the 72-year-old who collapsed while walking his dog. He had taken the same blood pressure medication for years, believing it was keeping him safe. What he didn't know was that his prescription, a calcium channel blocker called verapamil, had been quietly slowing his heart rate too much. His pulse dropped so low that his body couldn't keep up. The day he passed out wasn't random. It was the result of a medication doing exactly what it was designed to do, but without proper oversight. Calcium channel blockers are commonly prescribed for high blood pressure, chest pain, and certain types of arrhythmia. Drugs like verapamil and diltiazem work by relaxing blood vessels, making it easier for blood to flow and reducing the heart's workload. They're effective, and they've saved lives. But in older adults, these same benefits can tip too far. As we age, the electrical system of the heart becomes more fragile. The body doesn't adapt as quickly to changes in position, stress, or hydration. When a medication slows the heart's rhythm too aggressively, it can lead to dizziness, fatigue, and in serious cases, fainting or even heart block, a dangerous condition where the signals telling the heart to beat are delayed or disrupted. Complicating matters further, these drugs can interact with other medications, especially those also affecting the heart, kidneys, or nervous system. The result can be swelling in the legs, shortness of breath, or confusion. Too often, these symptoms are attributed to aging or other illnesses, when in fact, the underlying issue is the medication itself. The biggest problem isn't the drug, it's the lack of monitoring. Seniors are often prescribed calcium channel blockers and then left on them for years without regular heart rate checks, blood pressure follow-ups, or assessments of side effects. And because these medications are considered standard, few people question them. If you're currently taking a calcium channel blocker and have noticed that you feel slower, more tired, or dizzy when standing, it's worth looking closer. These symptoms may be subtle signals from your heart that it's time for a review. Never stop heart medication on your own, but always ask if what you're taking is still the best option for your age, condition, and current health. Your heart deserves nothing less than thoughtful, tailored care. Medication should protect you, not put you at risk. But after 60, even the most familiar pills can take on new meaning. The way your body processes drugs changes with age. Your kidneys, your liver, your heart, they all become more sensitive. And what once helped you may now be silently working against you. We've talked about 7 common medications today: pain relievers, diabetes drugs, sleep aids, antidepressants, decongestants, reflux treatments, and yes, even blood pressure pills. Each of them serves a real purpose. Each of them can be beneficial in the right context. But left unmonitored, taken for too long, or used without adaptation to your changing body, they can slowly erode the very system they were meant to support. That doesn't mean you should fear your prescriptions. It means you should respect them, review them regularly, ask your doctor questions. Are these still the best options for me? Have my needs changed? Could this be why I'm more tired, more dizzy, or more swollen than I used to be? The conversation may seem small, but it could save your heart. Charles is now doing better. After switching to a different medication and monitoring his pulse more closely, he's regained his energy and his confidence. His story isn't rare. It's just one that most people don't know to tell. So here's your chance to take charge. Don't wait for a warning you can't ignore. Look through your medicine cabinet with a wiser eye. Talk to your healthcare provider. Share this message with someone you love. Because the strongest heart isn't just one that beats hard, it's one that's protected with knowledge, awareness, and care. And if you found this video helpful, subscribe to Golden Heart Advice for more expert-backed insights that help you live longer, stronger, and safer after 60. Together, we're making these years your healthiest chapter yet.